You might think a dog cold is just, well, a dog cold. But here's something that really makes you look twice.
Oh,
Canine influenza, it actually has direct genetic links to viruses we find in horses and even birds.
that's quite a jump.
Exactly. So today we're taking a deep dive into these canine influenza viruses, or CIV. They're technically orthomyxoviruses. The real question is, what's the actual story behind this bug?
That's a great question. And for you listening in, wanting to be in the know, especially about, potential health issues for your dog, well, this deep dive should help.
How so?
We're aiming to give you a clear, efficient understanding of CIV. We've pulled together the key info, the essentials, without getting bogged down in, super technical jargon.
Right. Our mission here is to extract the most crucial nuggets about canine influenza. We'll look at where it came from, how it spreads, the warning signs,
Mhm.
and really what you, as a dog owner or just someone interested in animal health, really need to grasp. So let's start right at the beginning. Fundamentally, what is canine influenza?
Okay, so at its core, canine influenza is a contagious viral disease. It can hit dogs pretty suddenly, that's the acute form, or sometimes it develops a bit more slowly, subacutely.
And mainly affects.
Primarily the respiratory system. But the fascinating part, as you mentioned, is that genetic link. The H3N8 strain, the one we see mostly in the U.S.,
Alright.
it has evolutionary ties back to equine influenza horse flu. And then the H3N2 strain, that one's linked to avian influenza from East Asia, birds.
Wow. That interspecies connection is really something. It makes you wonder how these viruses make those leaps.
It's a huge area of study, absolutely.
Yeah.
But sticking with dogs for now,
Hmm.
how does it actually spread between them?
Good question. How does it pass around?
Well, the main ways are pretty direct. First, through those tiny airborne particles,
Mhm.
when an infected dog coughs or sneezes.
Right, the aerosols.
Exactly. And second, through oral contact with contaminated surfaces. So think shared water bowls, toys, kennel surfaces, anything the virus might have landed on.
Okay, so it gets in through the nose or mouth. Then what happens inside the dog? Where does the virus go to work?
It primarily sets up shop and replicates in the epithelial cells lining the upper and lower airways.
Mm.
Those are the cells on the surface of the breathing passages.
Uh-huh.
There's also some evidence suggesting it might involve alveolar macrophages. Those are important immune cells down in the lungs.
Yeah.
But the specifics of that interaction are still being worked out.
So the body obviously tries to fight back. What does that look like? Is there an immune response?
Oh, definitely. The immune system kicks in. We can usually start detecting antibodies, the body's specific fighters against the virus, around 8 days after infection.
And do those antibodies stick around?
They can, yeah, often for more than a year. But here's the thing. The big question is, what level of antibodies actually protects the dog?
So having antibodies doesn't automatically mean they're immune.
Not necessarily, or at least we don't know how much protection they offer. Understanding these protective immune responses is really key. It's actively being researched and could help us make better vaccines or treatments eventually.
That makes total sense. Now, you mentioned two main types, H3N8 and H3N2. Let's break those down a bit. What's the story with H3N8?
Okay, H3N8. That was the first one identified in dogs in the U.S. It popped up back in 2004, initially in greyhounds at racetracks.
Racetracks. Interesting. And where is it now?
Well, it's now considered enzootic in non-racing dogs along the eastern seaboard, basically from Connecticut down to Virginia.
Enzootic meaning it's just there, regularly circulating in that dog population.
Pretty much, yeah. It's established there. We do see it flare up in other places sometimes, but that's usually linked to dogs moving around, being transported from or through that area.
Gotcha. And H3N8 primarily sticks to dogs.
That seems to be the case. Natural infections so far have mainly been reported in dogs. There's this observation about greyhounds sometimes showing more severe signs.
Right, you mentioned that.
Yeah, but it's tricky. Other factors could easily be involved there, maybe housing conditions, stress, other underlying health things. It's not necessarily just the breed itself.
Okay, good point. So that's H3N8. What about H3N2? How is it different?
H3N2 has a different backstory. It was first officially detected in Korea in 2007, but there's evidence it was actually around in China a bit earlier than that.
And its origins, not horses this time.
No, this one points back to birds. Avian influenza. The thinking is it likely emerged from those live animal markets in East Asia.
Live animal markets. Yeah, we hear about those often in the context of new diseases jumping species.
Exactly. And here's a really crucial difference with H3N2. It doesn't just infect dogs.
Oh. Who else?
It can infect cats, too.
Both dogs and cats. Wow. That definitely broadens the picture.
It really does. It has wider implications for spread and, managing outbreaks. Plus, generally speaking, clinical experience suggests H3N2 infections tend to cause somewhat more severe signs in dogs compared to H3N8.
Okay, that's definitely worth noting, especially for households with both dogs and cats. Now, thinking about risk, are certain dogs more likely to get it? Specific breeds or ages?
Based on what we know now, it seems like all breeds of dog are susceptible, both to H3N8 and H3N2.
Really? No breed is safer than another.
Doesn't appear so.
Oh,
And the same goes for age. There's no age restriction. Puppies can get it, senior dogs can get it.
why is that?
Well, a big part of it is that these viruses are relatively new to the canine population. Most dogs simply haven't encountered them before, so they haven't had a chance to build up any natural immunity. They're what we call naive to the virus.
That makes sense, like when a new human flu strain appears. So, okay, let's say a dog does get infected. What are the key signs an owner should be watching for?
Well, first off, a pretty high percentage of infected dogs do show signs. We're talking somewhere in the range of 60 to 80%.
So it's not usually silent.
Not usually, no.
Yeah.
The incubation period, the time from exposure to symptoms starting, is typically quite short, about 2 to 4 days.
And what's the first thing you might notice?
Often it's a modest fever, maybe 103 to 104 degrees Fahrenheit, that usually lasts for about 3 to 6 days.
Okay, a fever. What about the classic respiratory stuff? Coughing, sneezing.
Yes, those usually follow. It often starts with a clear nasal discharge, but then this can thicken up, become more mucoid or even pus-like.
Which might mean...
That often signals that secondary bacterial infections are taking hold. They're kind of opportunistic, jumping in while the virus has weakened the respiratory defenses.
Right. And can it get worse than just a runny nose and fever?
Unfortunately, yes. In more severe cases, usually around 6 to 10 days after the infection starts, dogs can develop a higher fever, actual pneumonia.
Oh, dear.
Yeah, and you might notice they're breathing faster, or it looks like more effort to breathe. And then there's the cough. A very common sign is a cough that can be quite persistent. It can linger for several weeks, sometimes long after the dog is actually contagious with the influenza virus itself.
That lingering cough would be worrying. Early on, I imagine those initial signs, fever, runny nose, cough, could look like a lot of other things.
Absolutely, especially kennel cough.
So what are the actual causes and the big risk factors that make a dog more likely to catch CIV?
Well, the direct cause is straightforward. Infection by one of the canine influenza viruses, H3N8 or H3N2. But the biggest risk factor, by far, is situations where dogs are grouped together. Kennels, doggy daycare centers, rescue shelters, boarding facilities,
Yeah.
anywhere dogs are in close contact, or even just contact with dogs from those environments.
Because it spreads so easily in close quarters.
Exactly. Those airborne droplets and contaminated surfaces that we talked about earlier, they just have much more opportunity to spread in those settings. And again, because most dogs are susceptible due to lack of prior exposure, it can really take off quickly in a group.
It can really sweep through a place then. So if a vet suspects CIV, how do they actually diagnose it and tell it apart from, say, kennel cough?
It can be tricky, especially in a single dog showing mild signs early on. It looks a lot like kennel cough complex.
But you mentioned the group setting clue.
Right. A key indicator that might point towards CIV, especially in a kennel or shelter situation, is if a very high percentage of the dogs, that 60 to 80% figure, start showing respiratory signs around the same time. That's less typical for standard kennel cough outbreaks.
Okay. And what if it progresses?
Later on, if a dog develops pneumonia, that's a more serious flag. CIV can cause pneumonia directly, or it can pave the way for those secondary bacterial infections to cause pneumonia.
What about standard lab tests? Does blood work help?
Routine blood work, like a CBC or chemistry panel, is often pretty normal in the early stages of uncomplicated CIV.
Not very helpful then.
It can give some clues. You might see changes suggesting stress, like a stress leukogram. And if secondary bacterial pneumonia develops, then yes, you'd likely see changes like an increased white blood cell count, specifically neutrophils, indicating bacterial infection.
So blood work isn't the main diagnostic tool for the virus itself.
Correct. For specific CIV diagnosis, you need different tests. One option is a blood test looking for antibodies, a hemagglutination inhibition, or HI test on serum. This tells you if the dog has been exposed.
When would you run that?
It's most useful later on, usually after about 7 days from when symptoms started, because it takes time for antibodies to develop. For diagnosing an active infection, especially early on.
Yeah, like in the first few days.
Right. Within the first 1 to 3 days of symptoms, the best approach is to get a nasal swab. That sample can be used for RT-PCR testing, which looks for the virus's genetic material, or for viral isolation, which means trying to grow the virus in the lab.
PCR is pretty common these days. Are there any tests to avoid?
Yes, those rapid antigen capture ELISA tests that are sometimes used in clinics, they're generally not recommended for CIV. They have a pretty high rate of false negatives, meaning they might miss an infection that's actually there.
Good to know. Okay, so we know it hits the respiratory system. What's actually happening damage-wise down at the cellular level?
The main injury the virus causes is the destruction of those ciliated epithelial cells lining the upper airways. Remember, those cilia are like tiny brooms sweeping mucus and debris out.
So losing them is bad news for clearing the airways.
Exactly. It disrupts that crucial cleaning mechanism, and this damage can extend down into the lower airways, into the lungs themselves. In more severe infections, you can get areas of lung consolidation,
Consolidation meaning?
where parts of the lung tissue become dense and firm, filled with fluid and inflammatory cells, instead of being light and airy for gas exchange. This typically happens around 6 to 10 days after infection starts.
That definitely explains the potential for pneumonia and breathing difficulties. So, shifting gears to managing this, what's the approach for treating a dog with CIV? And maybe just as importantly, how do you stop it spreading?
Preventing spread is absolutely priority number one, especially in multi-dog households or facilities. The main contagious period is generally thought to be about 6 days after the dog first starts showing symptoms.
Only 6 days? Even if they're still coughing?
That's a really important point. Yes, the cough can linger for weeks, but that doesn't necessarily mean they're still shedding infectious influenza virus after that initial 6-day window.
Okay, so isolation is key for that first week or so. What about treatment? Do they need to be hospitalized?
For uncomplicated cases, meaning no pneumonia, no severe breathing issues, outpatient care at home is strongly recommended.
Why is that?
To minimize the risk of spreading the virus within a veterinary hospital, you really want to reserve hospitalization for the dogs that truly need it, those with pneumonia requiring IV fluids, oxygen support, that kind of thing.
Makes sense. So for home care of an uncomplicated case, what are the main things?
Enforced rest is critical, absolutely essential.
How long?
For uncomplicated cases, usually 14 to 21 days of restricted activity. No rough play, no long runs. If pneumonia develops, that rest period needs to be much longer, sometimes up to 2 months, to allow the lungs to fully heal.
2 months. Wow. Any other considerations for home care?
Yes, something related to those secondary infections. If a dog gets pneumonia caused by Bordetella bronchoseptica, that's a common kennel cough bacterium,
Right.
they might actually remain infectious and shed that specific bacteria for several months, even after they've recovered from the influenza virus itself. So continued caution around other dogs might be needed.
Good point. Okay, what about specific medications? Are there antiviral drugs for canine flu, like Tamiflu for humans?
That's a common question.
Yeah.
But currently, no antiviral drugs have been consistently proven effective against CIV in dogs. So treatment really focuses on supportive care and managing those secondary bacterial infections.
So antibiotics are common.
Very common. Usually broad-spectrum ones initially, like amoxicillin combined with clavulanic acid or doxycycline or trimethoprim sulfadiazine. These cover many of the likely bacterial culprits.
And what if the dog is really sick or not responding to those first-line antibiotics?
For more severe cases, or if there's suspicion of resistant bacteria, vets might move to combination therapy. Perhaps an aminoglycoside antibiotic like gentamicin or amikacin paired with a cephalosporin like cefazolin.
Okay.
Enrofloxacin is another option sometimes used. And for dogs with severe bronchopneumonia, the antibiotic course needs to be quite long, generally continuing for at least 2 weeks after chest x-rays show improvement.
And if you suspect a really tough bacteria, like a resistant Bordetella,
Then it's really crucial to get a culture. Take a sample from the airway, send it to the lab, find out exactly what bacteria it is and which antibiotics will actually kill it. That's antibiotic sensitivity testing.
makes sense. Any other approaches for resistant bugs?
In some challenging cases, particularly with Bordetella, delivering antibiotics directly into the airways using a nebulizer might be needed.
Nebulized antibiotics, like...
Drugs like kanamycin, gentamicin, or polymyxin B can be used this way, often for about 3 to 5 days, to get high concentrations right where the infection is.
Interesting. What about just managing that persistent cough? Can anything help with that?
Yes, thankfully. Cough suppressants can provide some relief, especially if it's a dry, hacking, unproductive cough that's distressing the dog or keeping everyone awake. Medications like butorphanol or hydrocodone bitartrate are sometimes used.
Okay. Anything else? Bronchodilators.
Bronchodilators, like theophylline or aminophylline, are sometimes tried, but honestly, they usually aren't very helpful for the cough associated with CIV unless there's maybe some underlying condition causing wheezing too.
So mostly supportive care, antibiotics for bacteria, rest, and maybe cough suppressants. Got it. What about longer term things? Especially thinking about those kennel or shelter situations
Yeah, if an outbreak happens at a facility like that, a common recommendation is to actually evacuate the dogs from the affected area for maybe 1 to 2 weeks.
to break the cycle.
Exactly. And during that time, thorough cleaning and disinfection is vital. Canine influenza virus is susceptible to common disinfectants, things like diluted bleach, a 1.30 dilution of regular household bleach, or chlorhexidine solutions, or quaternary ammonium compounds like benzalkonium chloride.
Okay. And for an individual dog recovering at home, what's the expected timeline?
For an uncomplicated case, you should see noticeable improvement within about 10 to 14 days. If that cough is still going strong much beyond 14 days, it's definitely worth a recheck with the vet. It might mean something else is going on or the diagnosis needs another look.
And what about immunity after infection? If a dog gets CIV, are they protected?
Well, we talked about the uncertainty around protective immunity from the virus itself,
Yeah.
but if they had that secondary Bordetella infection we mentioned,
Mhm.
they do tend to develop some immunity specifically to that bacterium, usually lasting at least 6 months. As for overall outcomes with CIV, the mortality rate thankfully isn't usually super high, but it is variable. It really depends on how severe the secondary bacterial infections get, maybe the specific virus strain, and definitely the level of veterinary care provided.
Right. Okay, one last crucial question. Is there anything proactive owners can do? Can we vaccinate against this?
Yes, and this is important. There are currently 2 licensed vaccines available in the U.S., specifically for the H3N8 strain of canine influenza.
Just H3N8, not H3N2.
Correct. The currently licensed vaccines target H3N8. While they might not completely prevent infection, they are intended to help reduce the severity of the illness and shorten the duration of viral shedding if a vaccinated dog does get exposed.
So it's definitely something to discuss with your vet.
Absolutely,
Mm.
especially if your dog is frequently in those higher risk situations we talked about, boarding, daycare, dog shows, shelters. It's a key preventative measure to consider.
Okay, great. So let's try to wrap this up. We've covered a lot. It seems canine influenza is, well, more complex than just a dog cold. It's a contagious respiratory virus genetically linked to horse and bird flu.
Those orthomyxovirus roots.
Right. Two main players, H3N8, which has a vaccine, and H3N2, which can also hit cats and might be a bit rougher on dogs.
Yep.
Big risk factor is group housing. Signs often include fever, nasal discharge, and that potentially long-lasting cough. Management focuses on rest, supportive care, antibiotics for secondary bacteria.
And strict hygiene to prevent spread.
Exactly.
Right.
And vaccines are an option for H3N8.
That sums it up nicely. And it kind of leaves us with a final thought, doesn't it, for you listening?
Yeah. Mhm.
Considering this virus jumped from birds and horses, and one strain even affects cats,
Mm.
what other animal health challenges might be lurking out there, especially in places where different species mix, like those live markets or even farms or shelters?
Right. That's a slightly unsettling thought.
Well, maybe less unsettling and more thought-provoking. It makes you think about what broader strategies beyond just a vaccine for one specific bug we might need. Things related to animal management, biosecurity monitoring. How do we better protect animal health in general and maybe prevent the next jump? It really shows how interconnected everything is.